I'm Thomas Love, Data Director for Better Health Greater Cleveland, and I want to tell you something about Better Health's unique role in our community. Our shared vision is to make Northeast Ohio a healthier place to live and a better place to do business. This brief summary highlights some of Better Health's achievements presented in our new report and some of the ways in which Better Health and the commitment of its partners to collaborate and to share data can help us achieve our goals. Our new report describes more people than ever before. In all, over 140,000 receiving health care, including more than 34,000 patients with diabetes. 4 out of 5 of our diabetes patients also have high blood pressure, and in total we report on nearly 135,000 high blood pressure patients, as well as more than 6,300 patients with heart failure, and nearly 1,700 with all 3 conditions. Our new report describes 638 doctors and other care providers from 8 health systems. Better Health works for everyone, from Care Alliance, where 80% of the patients are homeless and the rest live in public housing, to the Cleveland Clinic. These are all the good guys who are to be commended for their commitment to collaboration and to transparency through public reporting on the care they provide and the results of that care. A few highlights of those results. First, we'll compare Better Health's achievement for 2012 to the most recent available data from the National Committee on Quality Assurance and HEDIS on 6 key measures of comprehensive diabetes care, including keeping blood pressure controlled, good control and avoiding poor control of blood sugar as measured by hemoglobin A1C, keeping cholesterol controlled, getting a diabetic eye examination, and managing kidneys through screening for trouble or the use of particular medications to avoid further trouble. NCQA provides data for U.S. health plans. We'll start by looking at the commercial health plans and comparing to Better Health's commercially insured patients. I'll place a check mark here to indicate when Better Health's achievement across the region is better than the national average. And that's true for all 6 of these measures, which is great news. And in fact, for cholesterol control, Better Health's results are better than more than 90% of commercial health plans in the U.S. So that's great for folks with commercial insurance, but what about Medicaid patients? All of us living in Ohio are affected by what's happening in Medicaid, and we're also better than the national average on all of these measures, and above the 90th percentile of Medicaid health plans on 2 of them. And the good news continues for the uninsured. Of course, we don't have a national health plan average for them, so we compare them to the national Medicaid averages, and for patients with Medicare. And in fact, we don't just beat the average on these 6 measures, but as you'll see in our full report, we do so for all insurance types on all 10 measures of comprehensive diabetes care published by the NCQA and HEDIS. Improving primary care means improving population health on measures that matter, including blood pressure control, weight control, and tobacco use. Among our diabetes patients, the numbers still leave a lot of room for improvement. Even among our patients with diabetes, but not depression, only 72% have their blood pressure controlled, only 78% are not smoking, and a mere 35% are not obese. And our patients with both diabetes and depression show even worse results, with blood pressure and weight less likely to be in control and only 2/3 of patients not smoking. Depression status is a new and important breakdown for us here at Better Health. Our diabetes outcome score describes how well patients and their providers, working together, did at meeting goals for controlling blood sugar, blood pressure, cholesterol, weight, and smoking. Since 2007, the number of patients meeting this standard has increased from about 9,500 patients to nearly 14,000. And overall, we've gone from 37 to 41% of our patients meeting this diabetes outcome standard. We also report these scores broken down by other factors, like the type of insurance the patient has. For high blood pressure, for instance, we report in 2012 that over 70% of our Medicare and commercial patients have their blood pressure under control, while this is true for only a little over half of our Medicaid and uninsured patients. We can also compare Better Health's results to the national average of 47%, as reported by the Centers for Disease Control. So, Better Health sites have a better rate of high blood pressure control across all 4 insurance types. And in fact, 54 out of Better Health's 56 practices reporting in 2012 beat that national average of 47%. And overall, we're at 69% control for these more than 134,000 patients. So lots of work still to do, but we've made some good progress. Finally, Better Health is proud to honor its partner practices with its 2012 Gold Stars. The practices listed here have earned special recognition for their outstanding improvement and for their high achievement on crucial measures of care and outcomes for patients living with diabetes, high blood pressure, and heart failure. All 8 of our participating systems have at least one practice receiving this recognition. Congratulations to all of our partners and to their patients. Please explore our new data website to see the difference we've made so far and catch a view of where we'll go next. Together, we're making a difference in Northeast Ohio.